So a little bit about me. I am 34 years old. I was 180 pounds. My measurements were, I want to say like 44, 41, 42, 41, 42, maybe 43. I'm 5'4", and I have two autoimmune diseases. I have Crohn's disease. It is like an irritable bowel disease type of disease that I am on. I take injections every 2 weeks. I did have to stop those injections 30 days before surgery. And I also have a skin condition which is called hidradenitis suppurativa. So that's it. That's pretty much as far as my background story. Also I've had 4 children, vaginal births. So it's granted, with aging and with the lovely miracle babies that I've had, I decided to get a tummy tuck and 360 lipo BBL combination with Dr. Dress at NewLife Cosmetic Plastic Surgery. So before we get into like the surgery part, whatever, I do want to talk about medications and different things that I did leading up, especially within the 30 to 60 days leading up to surgery. I was a smoker. I've smoked for 20 years. I stopped smoking about 32 days before surgery. It was required of me to stop smoking 30 days before surgery. So if you're a smoker, you're definitely going to need to and want to quit. Also, because of my Crohn's disease, I normally have low hemoglobin. My hemoglobin usually sits at about 10 point something. Sometimes it could even get as low as 9.8, so that's usually where I sit. For surgery, for Dr. Dress requirements, my hemoglobin needed to be above a 12. So I took 2 things every single day to get my hemoglobin up. Unfortunately, I don't have the bottle. I just ran out today. It's called SSS Tonic, and I took it as directed on the label. And I also took this Hemaplex. You take 2 capsules. I don't know if you guys can. There we go. So these are iron capsules. 2 capsules I took every day as well. Doing that, and I started that pretty much when I scheduled myself for surgery. So surgery was January 23rd of this year, 2024. I believe it was the first week of December. I decided to have surgery and I put my down payment, and that's when I started taking my iron supplements to raise my hemoglobin. So by the time I went for surgery, my hemoglobin was somewhere between a 12.5 and a 12.7. Also, I took a multivitamin. Any multivitamin that you choose. I have the one a day, there we go. The one a day women's tablets. I took that every day, but that's pretty much what I took every single day leading up to surgery. I took my multivitamin, I took my Hemaplex, and I took my SSS tonic every day. So as far as the supplies that I got, right, for medications for after, right, what you're going to need after. You're going to need vitamin C. You're going to need vitamin C, vitamin D, and zinc. So I got this medication called Super C. It's by Nature Made. And as you see, it's got vitamin C with vitamin D and zinc already in it. You're also going to need papaya chewables. This is to help aid with your digestion after surgery. Some people may experience that their appetite isn't really there like it is, or they have a hard time digesting foods, whichever it may be. This is good for that. Also, most importantly, your turmeric and bromelain. You're gonna need turmeric and bromelain. So very excited. I came across, and all this stuff I got off Amazon. Most of it you might be able to find in Walmart, but most of all this stuff I got in Amazon. This stuff right here, turmeric with the bromelain. Like you know the bromelain is in pineapples. It's really great. It helps with inflammation, especially after this type of surgery. So you're gonna want to get something like this, and I found it in a combo capsule on Amazon. You're gonna take this every day after surgery. Talked about that. I also brought Tylenol for after surgery because with my Crohn's disease, I can't take NSAIDs, which are basically like a non-steroidal anti-inflammatory drug. It's the long word for NSAID. It's usually you will find them in Motrin, Aleve, ibuprofen, your arnica tablets, right? So I do have arnica tablets, which is these are melt-away tablets. It's to help with pain relief, swelling, and bruising with injuries, right? Especially after surgery. This comes with that NSAID component. So if you're somebody like me that cannot take those type of medications, you can find arnica without NSAID. So I just thought that was great because you're definitely going to need this to help with the bruising and swelling. Let's see. You're also going to need a stool softener. I won't really show you guys that because my address is on here. Well, I guess I can cover it up. But this is Colace, basically, docusate sodium. You're going to need a stool softener because on the day of pre-op, before surgery, they are going to give you your prescriptions. At this particular clinic that I went to, they give them to you the day before. And you can fill your prescriptions the day before, which I highly, highly, highly recommend that you do so that you have your medications after surgery. When my husband came and picked me up, from surgery, he had my medications with me, and I was able to take them right then and there because I was definitely in pain. So the medications that were prescribed to me, normally Dr. Just will prescribe a narcotic. So I got oxycodone. He's also going to prescribe a antibiotic. And I believe this is for 7 days. Yep, twice a day for 7 days. And he's also going to prescribe medication for nausea, just in case you, you have trouble with nausea after. I did not so much. I actually still have some of this medication left. I think I only took it like once. And then I believe that's it. Now, because I am I wouldn't say because, but it's because I am a registered nurse, right? So I know a lot of it when it comes to medications, recovery, patients that are recovering and stuff like that, medications that are usually prescribed to patients after surgery. So I had asked Dr. Drust about a muscle relaxer, a non-habit forming muscle relaxer called Robaxin. And also I asked about gabapentin because gabapentin helps with nerve pain, which we will definitely be experiencing after surgery, that pins and needle burning type of firing, that we get because our nerves are, waking back up, rejuvenating and all that good stuff. It's painful. We're going to feel that. So I know personally from my line of profession that gabapentin is great for that. So I requested from Dr. Just if I could get these two medications. He had no problem prescribing these to me. And it definitely helps with pain, and it helps me not have to take the narcotic pain medication so much, which is personally important for me. Okay. What I'm drinking right now actually is Smooth Move. Because of the the narcotic pain medications, it can cause you to, not can, it's not a matter of if, it's a matter of when. Narcotic pain medications, opioids will definitely constipate you. And being constipated after surgery is probably like the worst thing that you could probably imagine outside of something really traumatic, post-op complication happening. Having all that tightness and inflammation on top of not being able to have a bowel movement is just whoo. So this Smooth Move, it's a tea. I've been drinking it once a day just to like help keep my bowels going. And it's been working great. I've been able to have a bowel movement every day, which is going to be very important after surgery, right? And I think that's pretty much it when it comes to the medications. All right, guys. The supplies that I bought here to Miami, most importantly, chuck pads. These chuck pads is what you'll lay on your bed because you will be draining quite a bit, especially the first 2 days. The third and fourth day, not as much, but you will be draining still. These chuck pads, you'll lay on the bed so you don't get blood on the bed. I also bought a box of 4x4 gauzes. Now, this 4x4 gauze it is be used for great, used to cover up the leaking holes and stuff like that. I also bought Band-Aids too. I bought, this is hospital grade wound cleanser, which Dr. Just said it was absolutely fine to use. It's called the Vosh. And yeah, I just dabbed on like the lipo holes. Just dab it, just try to keep it clean. I also bought maxi pads. These I would use to help cover my tummy tuck incision line. Then I would put my shirt over it, and then I'd put the abdominal binder over it. It's just to help with extra cushion. I also bought gloves, right? I bought a female urinal. Ooh, this comes in handy. I cannot stress this enough. I cannot. If you don't listen. If you don't learn nothing from this video, make sure you bring this female urinal. Oh my goodness. It helped so much. I also bought some hospital grade cleansing wipes. We call these purple top wipes in the hospital. You can buy these off Amazon, but they're Sani-Cloth, and they literally clean. There's a long list right here of it literally disinfects every bug, bacteria, virus known to man, pretty much, including, of course, the COVID-19 virus. Though these wipes are what I used when we first came into our Airbnb, me and my husband, we wiped down everything. We also brought our own sheets and pillowcases. And we just did that. I just did that, because, I just am very big on infection. I don't, want to get infection, obvious reasons, right? So, and it's not that this Airbnb, when we came in here, it wasn't clean. The Airbnb was gorgeous, beautiful. You definitely see they cleaned, but still, I'm going to wipe down everything with those purple top wipes. I also bought, medical tape too. And, of course I bought Dial soap. Dial soap is what you're going to use to cleanse your body before surgery. It's a great antibacterial soap. It will leave your skin very clean and dry. So it's not the soap that I personally would use on a day-to-day basis. I love my Dove soap, but it's what I've been using, these days after surgery as well. As far as the supplies, that's pretty much if I find that I forgot something, oh, hydrogen peroxide. Hydrogen peroxide, I use that to put on the blood stains, right? And put it in the wash machine and the blood stains will come out. It works great. But if I forget anything, as far as supplies go, I will definitely add it to the information below, the more information below so you can see. But I think that's pretty much it as far as the supplies go. I also got this, I just seen it in the bathroom. I also bought, of course, I bought my BBL pillow. But there is a like a BBL pillow. It's not really a pillow. It's really hard for the toilet. So when you're trying to have a bowel movement, of course, you don't want to sit on your butt, right, for a prolonged period of time. So I just thought that was so great. This is basically what it looks like. It's really, really cool. You can just sit it on the toilet. If I didn't address anything, please write it in the comments and I will definitely respond back to you. You can also, again, follow me on Instagram, underscore Dr. Dress Doll Official underscore. And you can send me messages there and I will definitely get back to you on Instagram as well. Alrighty, I'll see you next time.